I really do think of it as just another herb, and I recommend herbs and adaptogens all the time. I'm recommending reishi and ashwagandha and tulsi and all of those things. And it's just another herb, and they all kind of do different things. And this is what this one can help with.
Welcome to the Well with Cannabis podcast, a show dedicated to telling the life-changing stories of those who live well with cannabis, all while teaching you how to do the same. Meet your host, Emily Kyle, a registered dietitian nutritionist turned certified holistic cannabis practitioner. Emily changed her life for the better with the help of the cannabis plant, and now she is committed to helping others do the same. Tune in each week to hear heartwarming stories and gain the knowledge you need to feel connected, inspired, and supported on your own cannabis journey. Whether you're a new cannabis consumer or a lifetime lover, you'll benefit from these uplifting tales of real-life journeys that will show you how you too can live your best life well with cannabis.
Before we jump into today's episode, I wanted to share a note on potentially sensitive content. The episodes on the Well with Cannabis podcast are created for adult audiences only. We will at times cover sensitive topics including, but not limited to, suicide, abuse, mental illness, sex, drugs, alcohol, psychedelics, and the obvious use of plant medicine. Explicit language may be used occasionally. Please refrain from watching or listening to the show if you're likely to be offended or adversely impacted by any of these topics. The information on this show is for informational and educational purposes only. It does not constitute medical advice. If any of the content on this podcast has brought up anything for you, please reach out or speak to a professional or someone you trust. Hello, and welcome back to another episode of the Well with Cannabis podcast. And I am so excited for this episode. After over 30 interviews, this is the first time I'm interviewing someone I actually know and who is not a complete stranger. And so I'm so excited to welcome Melissa Groves Azzaro. She's a fellow registered dietitian nutritionist. And so we bonded in that part of our career. It's been a couple of years. I've been so lucky to be a guest on her podcast, The Hormone Dietitian, and I am really excited to let her talk about her personal and professional experiences with cannabis with you today. So, Melissa, welcome. Thank you so much for joining me today.
Thank you so much for having me. I'm excited to chat.
And I am sorry, you have recently went through a big health change. And so you were always working originally as a registered dietitian nutritionist focused on women's health and hormones. Is that correct?
Yeah, I'm a second career RD. So for the last 5 years, I've had my practice, the Hormone Dietitian, where, I specialize in women's health and hormones exclusively. And primarily I work with people with PCOS, which is polycystic ovary syndrome. I do not have PCOS. I have had other hormone imbalance issues throughout my life, and that's what we'll be talking about today.
Yeah. So as a dietitian, of course, we have to talk about our health and profession, but I'm going to put that on the back burner. And I really want to talk on a personal level. Here, everybody's just sharing how cannabis has helped them in their real life, and you kind of have a new story to tell. So if you're ready, tell us a little bit about your relationship with cannabis.
Yeah, I think, to put it in context a little bit more, I'm an integrative and functional dietitian. So, I'm looking at things like root causes. I'm considering all avenues of treatment when it comes to the person as a whole. So, in my professional perspective, cannabis is an herb, just like any of the other adaptogens or herbs that I would recommend in specific circumstances. And, we know the benefits of cannabis being anti-inflammatory, helping with, mood and sleep. And so it's always been something that I've not hesitated to recommend to my clients. And I think they're always kind of surprised when I bring it up. If they're struggling with something like endometriosis or really painful periods, if I ask them, have you tried cannabis? Does that help? They kind of, recover from the shock before talking, because nobody's ever asked them that before or brought it up as a positive, hey, this might be something you might want to try. So my personal relationship with cannabis, let's see, going back to college, that was the first time I had ever, I think that's pretty common. Most people try it. And I think my first impression, and I think we talked about this on my podcast, but my first impression, because my friend had a little wooden bowl. And so it tasted very like smoky to me. And I, mostly was eating plant-based, and I just, it was not, smoked is not a flavor you get a lot in the vegetarian, world. And so my first comment was, it tastes like ham.
Oh my gosh. I don't know if he's ham. I don't know if I could go back for a second and try.
I know, it's just that weird smoke. So, it's always been there. It was never a large part of my life. It was always, kind of occasional usage kind of thing for relaxation, more than anything. I'm a very high cortisol, high dopamine, high anxiety kind of person. So, what I have found in my own personal life with cannabis, as opposed to something like anti-anxiety medications like Xanax, or, even alcohol, which, wasn't helping matters, is, the day after something like that, you get kind of a worse anxiety hangover. And I've noticed that for myself. And, as part of what got me weaned off all anti-anxiety meds is I feel worse the next day. Whereas with cannabis, you can take a little bit, take the edge off, and the next day you wake up and live your normal life. You get up, you exercise, you eat breakfast. It's not like having a hangover, or you're not having that rebound anxiety that you can have with some of the pharmaceutical medications that can help with anxiety. So that's been my personal experience. What's been happening recently, and it goes back about 4 years, my gynecologist found polyps in my uterus, and she was like, "Oh, well, we'll just go in, we'll nip them out, they'll be gone. There won't be a problem." So, went in for the little hysterectomy surgery. It's basically like a DNC. They go in, you go home the same day. It's not very painful. 2 weeks later, I go in for the, post-op follow-up, and like the look on her face, it's bad. Like if a doctor can't hold their bedside manner, straight face, and the look on her face was just shock. And she was like, "I have some really bad news. They took out the polyps and the pathology came back questionable." And I said, "What do you mean it's questionable?" And she said, "Well, it came back, it's endometrial intraepithelial neoplasia, which is basically endometrial hyperplasia. Complex atypical hyperplasia is what they used to call it. And now they call it EIN. Cannot rule out adenocarcinoma stage 1. And they took my slides, and they, the pathologist at the hospital where I had the surgery read them. They sent them up to Maine. They sent them down to Johns Hopkins. I am still getting bills from Johns Hopkins from the pathology department for reading these slides. And I was like, "Well, what do you mean question mark? What does that mean?" So she said, "I recommend you immediately book an appointment with a gynecologist oncologist." So I go to this female gynecologist oncologist who was Harvard educated, and, with the hair and the nails and the high heels. And she was like, "I recommend immediate hysterectomy." And I was like, "Excuse, at this point I'm, 41, 42. I'm still having regular periods. I'm really not having any issues. It wasn't like, I was having heavy bleeding. My periods at this point, because now, doing what I do, my periods are better than they've ever been in my whole life." And I was like, "Don't you want to do some further testing and make sure it's cancer before you take out a properly functioning, organ?" And she was like, "No, if you want kids, I recommend IVF immediately. And then we take your uterus out as soon as you're finished having children." And I was like, "Okay, well, that's not an answer I'm willing to live with at this point. So doing what I do and all the testing and the, hormone nutrition and lifestyle support, I was able to see that my cancer causing estrogen, if you detox your estrogen down that pathway, when I started, it was at 19% and it should be below 11. And so after about 6 months of changes, I got it down to 3%. I eat broccoli sprouts like it's my job. So I really cut the risk. Took me a really long time because of a lot of complexity with health insurance and what was covered and what was not going to be covered. And, I got a second opinion and, surprisingly for me, because this was a male doctor, he was like, no, I totally agree with you. That's ridiculous. We want to go in, we want to do a DNC, we want to scrape everything out and see what's there before we make a decision about how to move forward. And I was like, that's something I can live with. Like, totally agree. But because of our health insurance, then we had to, this was around when I was getting married. So I was transitioning onto my husband's health insurance. He wasn't covered. And I knew that my past surgery was about $18,000. So I was like, I can't $18,000 out of pocket for a DNC, and so had to wait. And then COVID happened. So I was the last elective surgery day that they were doing surgery. It was March 16th.
Oh my God.
I had a DNC at the local hospital with this second doctor. And he found nothing. He found some abnormal cells. He didn't find any cancer. He said, okay, well, let's, move forward with having you come in every 6 months and we'll just do an in-office endometrial biopsy. It's going to kind of spot check and make sure everything's still where it was. So, we proceeded like that for another, I think I went in like 3 different times with him. And then we moved across the state. So now I'm 2.5 hours over. I was like, I might as well, I'm not really happy with my regular GYN over there. I'm just going to establish care over here. We're really close to Dartmouth Hitchcock, which is a big teaching hospital. My father-in-law was treated for cancer up there. I feel very confident in the care there. So I was like, okay. So then, of course, I had to wait about 6 months to get in with the GYN, the gyne-onc there. And then I got COVID.
Oh my God.
In March of 2022. No. So then, finally I see her in May 2022. And, and I really, I waited to see her because I knew she was good and I knew I would trust her opinion. And she was happy to continue what we were doing, which is, every 6 months, I go get an endometrial biopsy and, we see what the results say before we decide, are we moving forward with the hysterectomy or not? But she was very clear with me. My recommendation does not change. A hysterectomy is what I recommend. And the reason for that is because 97% of EIN turns into uterine cancer within a year. So, I was determined. I was like, I'm going to be that 3%, it's not going to happen to me, but this was always hanging over my head. And now, every 6 months, I have to drive an hour and 45 minutes up to this hospital, have this painful biopsy that they give you no anesthesia for, can't even pop a CBD on the way up there or back because I've got to drive myself an hour and 45 minutes. So, it got to the point where I was like, okay, there's never a great time. There's never a great time to undergo a huge surgery like this, but this isn't a terrible time. Business is always quiet through the holidays. My husband works in education. He has like the best health insurance. I was like, I'm not going to end up paying, I'm going to end up paying like $50 out of pocket for this surgery. So I might as well do it. And so for me, it was kind of preventive, but also it was just a big relief to have it, off my mind, just like, is this the year that I'm going to undergo this big surgery? Part of the other continuum is when I was 41, I would say I was less far into perimenopause than I I am, was before the surgery. And so once I had sort of started to experience that, and I was like, okay, I'm in that, my periods they're all over the place. They're, missing for 3 months. And then it's every 14 days. Like what's happening here? So, at that point I was a little more willing to do it. Unfortunately, because of that cancer, once that C word is on your chart, it's a radical hysterectomy. So, it's the most radical surgery that they do. So they basically take everything.
Everything?
So everything. They take the
ovaries and fallopian tubes?
Yep. She definitely recommends with that surgery, you get the uterus, the cervix, and the fallopian tubes. She was like 50-50 on taking the ovaries. And she was, she brought up all the risk factors with taking the ovaries at my age, at 46 to take the ovaries, bone density, heart disease risk, dementia. And, because of who I am, because I'm a dietitian, I was like, let me manage those risks. I can manage those risks. But I don't my biggest thing was I don't want to be back here in 5 years with breast cancer. So if you're going in and you're taking everything, you're taking everything. Like I want the ovaries gone. So we did everything, and she agreed with that. And, the most recent science supports menopause hormone replacement therapy up to the age of 50. So, for the next few years, I'll be on a low dose of estrogen, and I'm managing the cardiovascular risks with, I was like, you don't understand how many vegetables I eat. Like it's not a problem. And bone density, I've started lifting weights. I don't love it. I know I have to do it. So I've started doing that. But, with these surgeries, it's a major, major surgery.
A major surgery. Like that is huge.
Yeah. And that, the thing about the type of surgery, because there's different types of surgery, and you would think, oh, this is a radical hysterectomy. They're going to open my abdomen, but it goes based on the size of your uterus. And my uterus was only about a third enlarged over what it should be. And so she's like, we're going to do it vaginally with laparoscopic assisted. And so if you are laparoscopic, they send you home the same day. And she told me, she said, and I'm going to give you 5 oxycodone pills. And that's it.
That's it?
That's it. Send you home. Here's your 5 oxycodones. Good luck. Yeah.
I'm shocked. Anyway, and if you're just listening and not watching, I'm shocked. That is mean. What did you say?
I just, I did my doctor's office smile and nod, and then, instantly came home and started researching. What can I do? And, so knowing how much cannabis can help, especially with menstrual pain, and how much, in the past, I've really, really liked the 1-to-1 CBD THC ratio edibles for menstrual pain. That really helps. I was like, okay, we're going to go to the dispensary, and we're going to talk to the guy. Cause
so proud of you
and I know this, from talking to you and what I've learned from you, but, and also what I know from playing around with edibles is, it might not kick in for 2 to 3 hours. And so what I was really worried about was breakthrough pain. When you're in pain or you're sick, the worst part of the day is when you wake up in the morning, and you're feeling that pain. And, the thought of feeling that pain and having to wait 2 to 3 hours for something to kick in was, not, it was not something I was willing to do. So went to the dispensary. Actually, it was my first time in a dispensary. Usually I just
fun. Did you enjoy it?
I did. People who work there are so happy. So nice.
Aren't they the best?
So happy. But I don't know anything about vapes or, I just didn't know. I know they're quicker. I didn't know anything about how to pick one out, what I was looking for. And so, what he really guided me towards was 5-to-1 ratio of CBD to THC. And that was really great. And so I had my little, and I played around with it, the week or two before the surgery to see, okay, how long does this take to kick in? How long is this going to keep me, pain-free? And it's hard to tell when you're not in pain
But it's so smart to experiment the week before for anybody listening. That's absolutely the best thing you could do.
Yeah. So, I was like, oh, okay, well, this kicks in immediately. And it lasts for about 4 hours. So, the one that I got and the dose that he recommended I take. And so I felt pretty good going into the surgery that at least I had a plan. And so, when we had this hour and 45-minute drive back from the hospital after my surgery. And so I had my cute little vape pen, packed it in my little bag with my blanket and my, the belly binder and all of the things. I really don't remember much about the trip getting home, but I was worried about getting, from the car into the house, into bed. And it all went really fine.
Oh, good. Do you remember being in pain at that time?
Not necessarily. It was a weird feeling. I remember describing it as like the worst period cramps you've ever had. Plus, you kind of feel like you have a UTI because they do a catheter during the surgery. So like that was kind of burning, So yeah, there was a little bit of like weird feeling, but not necessarily like as bad pain as I thought I was going to be in. I also I'm very lucky, I've always been active. I was a ballet dancer. I ran marathons. Like my legs are really strong. So, even in the hospital, they were like, wow, you're moving much better than we were thinking you were going to. Okay. So yeah, so I felt pretty good with my pain management plan. And, it gave me the flexibility with those 5 oxycodones where I was able to spread them out, so it's like, okay, I'm going to save these and take them at night before I go to sleep. And then use the cannabis to manage the pain as needed throughout the day with, on top of ibuprofen and Tylenol, which they were having me cycle in the beginning.
Yeah. Mm-hmm. That was it. They're like, here's your Advil and Tylenol and good luck.
Yeah. And so the other thing about the type of surgery that I had is when they take your ovaries, you're instantly in menopause. So surgical menopause is no joke. I mean, menopause is no joke. But most of us have a several year period to kind of get used to what's going on. And so it's just, you're suddenly in menopause, and that brings all of the things that menopause brings, like hot flashes and night sweats, sleep issues. And I don't know about you, but sleep is like my number one priority. If I do not get my 8 hours a night, I am a monster. So it was really important to me to, continue getting quality sleep through the recovery. So that's another place where cannabis has really helped, with just, okay, I'm just going to have a great sleep and wake up and feel rested.
Do you find that you're still getting good sleep? Has it supported you throughout this transition?
Yeah. So I'm 8 weeks out from surgery, and I'm not using cannabis throughout the day. It's really just the, one little poof before bed. I'm kind of like almost afraid to stop doing that at this point, because it's like I sleep so deeply and so well, and I wake up refreshed, and I don't want to get to the point where I'm struggling with sleep.
Yeah, absolutely. Oh, I am so happy to hear that you had something to support you through that. And you also are so educated. You're such a good patient because you're an advocate for yourself. But then to have this on top of it, you really are the best patient. And that's kind of perfect to transition into your role as a healthcare provider, because I'm sure that this experience has given you such a greater empathy and compassion for the people that you work with. And I don't want to gloss over what you just went through. I just want to say thank you so much for sharing that, because I know it's pretty new for you too, and to share how cannabis has helped you manage the pain, I hope is really helpful for other people who experience a major surgery like that.
Yeah, and I would say, going in and talking to the people at the dispensary was super helpful because, like helping them understand what I was about to go through. It's like, okay, I want you to give me something that you would give someone who's having surgery, like, and soft tissue surgery pain is what I'm going to be dealing with. And so that really sort of helped them narrow down what to recommend for me. And I'll say, even the ones, and if you think of, you're going to be scared about feeling high all of the time with a 5-to-1 ratio. If you're taking 1 milligram of THC, you are not going to feel high. Most people are not going to feel high on 1 milligram of THC. So just having that has been so helpful.
And I'm so glad you said that, because for a lot of people, they don't want to feel high. The last thing they want to do is go into a surgery and come out feeling any type of way. So really hitting home that you only need a tiny bit of THC to hit the pain, and that you can offset some of those other unwanted feelings of THC with the CBD. So when she says 5-to-1, it's 5 times more CBD than THC. And that's always an option for people to try as well, because you don't have to get high to feel better. So I'm so glad you said that.
Yeah, I won't say I was feeling like super on top of things mentally, but, to lie there and recover and rewatch the Gilmore Girls from the beginning, it was like perfectly fine.
That is so good. And then hopefully this isn't too personal, when the 5-oxys were out, did you feel okay? Were you like, I can manage this pain on my own?
Yeah, absolutely. Okay. And definitely like with the last 2 nights, it was kind of like, I don't even really have to take this. I'm just going to take it so that I sleep
just
better.
In case. Yeah. I'm so glad that makes it like kind of a seamless transition. And that's how it should be. I mean, imagine if everybody was like, here's 5. And maybe if, we had the education to be like, here's a little cannabis, and we could just easily transition. I think it could save a lot of people a lot of problems.
Yeah, I felt like I had a really good transit. And of course, I was doing all of the other surgical support. And, this gets into the advocacy and the knowledge portion of things where, my doctor she's great. She's fantastic. She's great at what she does. She didn't tell me anything about nutrition, didn't tell me anything about working with a pelvic floor physical therapist. These were things that I had to research on my own. And I've used a surgical protocol with patients before. I've used it on my husband when he had his knee replacement, where we're doing extra zinc, to support the wound healing. We're doing extra zinc. We're doing vitamin C. We're doing collagen and bone broth to support the tissue healing. And then we're doing all of the anti-inflammatory stuff on top of that. So I was making a batch of fresh ginger juice every, once a week. And then I would pour that into my seltzer water and have a little, fresh ginger ale. I was doing turmeric. I was doing pineapple and bromelain, and super high protein, wound healing. I aimed for about 1 gram per pound of body weight. So really super high protein, and all of that, I think, helped my recovery go much more quickly and much more smoothly. And then reaching out to another healthcare practitioner, where I found a pelvic floor physical therapist who specializes in hysterectomy prep and recovery. So, for 4 weeks before the surgery, I was doing pelvic mobilization exercises. And then, from 10 days after surgery, I was able to start exercises and, and cardio. I was surprised. She was like, no, get up and do cardio. So, I'm talking like 5 minutes in the beginning, 7 minutes, 8 minutes, and just kind of built up from there. But, I'm at the point now where I can do 30 minutes again, no problem. And I'm only 8 weeks out. So, but these are things that doctors are never going to tell you.
I'm so glad you're telling people listening, because all of these things that you're doing contributed so much to your healing, I'm sure, that are not even meant, like you said, not even mentioned by doctors.
Yeah, I was actually shocked because if you read people's stories and you read what to expect during recovery, and I saw the statistic that was like 6 weeks out from surgery, you can expect to walk 30 minutes. 2 weeks out, you can expect to walk 10 minutes. It's like, okay, maybe that's like a very low bar. That's if you're not doing anything else. So, you're reading these things and you're thinking, oh, it's going to be terrible. I was worried about going to the bathroom. I didn't know what to buy for like after the surgery. I was like, I don't know. I'm a tampon person. I've been a tampon person all my life. Like, I don't even know what to buy, So I bought everything. I bought like
one of each
overnight pads. I bought, like Depends, because I was like, I don't know.
I bought Depends after I had my baby. I feel like most women actually try Depends for a few different reasons.
Yeah. Or you're searching. Then I'm like, okay, well, maybe this isn't right. So I'm searching like, post-surgical pads and things. And that takes you down the whole like C-section rabbit hole, which when you're having your uterus ripped out, doesn't really feel great to be like seeing all these like pregnancy ads. And so, so I bought everything. Peeing was not an issue. Like I was able to get up and go to the bathroom with no trouble. Again, those strong legs, like getting down front to the toilet and back up by myself was not a problem. So, some of the things that I was most scared of, like did not end up coming to pass.
Good. What was your favorite product out of all the products that you tried?
Yeah. So the one that I think is the most fun is the vape, because I had never done anything like that.
Yeah.
And it's some sort of blueberry haze thing where it doesn't taste like blueberry while you're inhaling it, but then there's sort of like a memory of blueberry.
Essence left behind.
I've been for a long time. I've been a really big fan of those Mr. Moxie's mints. They're usually the 2-to-1 or 1-to-1. And they had a 5-to-1 that was ginger. So they're mints that are 5-to-1. And those are great, especially for like the daytime, where it's like, okay, I just want to take the edge off the pain a little bit, but I don't want to feel knocked out, or like, I need to go to bed immediately. So those are good. There's another one. They didn't have it. My favorite one, which is another 1-to-1. It's their cherry flavored gummies in a little round tin. Those are always my favorite. Things that have not worked for me are anything nano, anything that says nano on it. My brain feels scrambled for days afterwards. So I can't do anything nano, but those are the ones. I can't remember what the blueberry haze brand is, but it's a little pen, disposable. It wasn't like we were going to invest in a vaping system or something. So they're just, little
but
things.
It's just so convenient and discreet and easy to use.
And so cost effective, I have to say, because
just one little puff,
and each little vape pen has something like 200 puffs in it. We were trying to do the math where it's like, okay, if I did one puff every night, how long? It's like one pen's going to last you, months. Yeah. So, really, really cost effective, because we definitely do enjoy, for more recreational purposes, the yummy chocolates with the, fun things on them. So a variety of stuff we've tried.
I have a question. I hope it's not too personal, but as a healthcare professional and someone who always advocates for yourself, did you tell your surgeon your plan to use cannabis?
No, I didn't. My surgeon knows nothing about any of the supplements or any of the anything, and that's always kind of the way that I've operated with doctors. I think on my record, it says I take a multivitamin and vitamin D. And, what I was doing for surgery, I was doing arnica and bromelain. And, I know the risks. So like I, stopped fish oil a week before surgery. I started it back up again a week after surgery. I managed that. But for people who are not healthcare practitioners and who are not super educated on the risks of supplements, definitely you should be working with someone who is. Some of the other things like increasing protein, like you can do that for the most part, unless you have like kidney problems. You can increase protein, but my dad just went through back surgery too, and I didn't have him doing any of what I was doing. I just told him to increase protein and take a multivitamin. Yeah.
I guess the sad part is I feel like even if you did tell your doctor about your supplement routine, like, would she even be able to like make not to be mean, but like an educated like opinion based on it, or she'd be like, oh, she takes a lot of supplements,
Yeah, I mentioned, and I thought she's definitely more open-minded than most doctors, but like I mentioned, the gene mutation that puts me at risk for this, the COMT gene. I have mutated 2 mutations on the COMT gene, which basically means my body does not methylate estrogen. Like it just doesn't. And she didn't know what that was. And so I think, it's like you kind of have to I have different doctors for different purposes. It's like
you read the audience. Yeah.
Yeah. It's like my PCP will handle, my annual cholesterol check. But like I'll see a naturopath to manage thyroid or anything hormonal that I need help with, besides myself. And that's actually something that I'm in the process of doing, is researching a new, more functionally minded doctor who can manage the hormone replacement for me, just to make sure it's the right thing for me.
Moving forward, you say you're not using cannabis daily. What does the future look like? How does cannabis play a supportive role when needed?
Yeah, I think it's going to continue to, play in the way that it always has, kind of on an as needed basis. And different forms work better for different things. I always talk about like the salves and the lotions. If I'm going to a conference or I'm going to New York City and I know I'm going to be walking 30,000 steps a day, I always pack that so that when I come home, I rub my feet with it and put them up, and that helps a lot. I think probably the most common time that I've used it over the last, 5-10 years is really for period pain. And so that's not going to be a problem anymore. So, it'll probably just be very sporadic as needed support. But I do use CBD, full spectrum CBD pretty frequently. It's sort of like, I don't drink alcohol, and I don't drink alcohol at home ever, period, anymore. And it sort of has that same almost ritual to me. At the end of a work day, I'm going to put a couple drops of CBD under my tongue, just to transition from work to relaxation. So, that's kind of how I use it. For the anti-inflammatory and anti-anxiety purposes, but I don't need the, even a milligram of THC for that,
I'm so glad. And it's nice that you just have it when you need it. If you ever come back and you need it for something else, you know how to use it, you know what you like. And that's really a beautiful thing. I always tell people it's a tool in the toolbox of wellness. And now you can just put it in your toolbox and wait until you need it again, which is amazing.
Exactly. It's additional support. Why would you not, if it's an option for you?
Absolutely. I love that. And I'd love to transition into your professional work. And you mentioned helping with period pain for yourself, but you work with women who have all sorts of female issues. Could you talk a little bit about that and how you've seen cannabis help them in any kind of way?
Yeah, I think, there's a lot of period pain out there. But more so than the period pain, I also see a lot of PMS or feeling, just feeling bloated, feeling like your sleep is disturbed, feeling the mood disturbances that happen. And the biggest category of people I work with have PCOS, which one of the main underlying drivers of PCOS symptoms is inflammation. So, CBD, minus the THC, but the CBD is so anti-inflammatory. I find it can be a helpful adjunct to treatment. It really is just that little extra bit of something that you need to feel good sometimes. And I think, if people are open-minded to it, so usually the salve is a good gateway product, because it's like, why don't you try rubbing some salve on your belly and see how that feels? I'll try to encourage like a full spectrum CBD, so that they're trying that and maybe sleeping better, feeling better. They're going to have more energy the next day. They're going to be able to exercise and, the things that they didn't have energy before. So yeah, I definitely recommend it. It's a tool in my toolbox that I do recommend with clients if they seem open-minded to it.
I was going to say, like, do you always bring it up? Do you sometimes bring it up? Do you just read the room, see who might be up for it?
Yeah, I read the room. I think I'm so open about who I am and what I believe in that I tend to attract the kind of clients who, are more open-minded. So that usually helps. And they're usually very excited. I love when I hear back from them that they got it and they tried it and they slept better than they ever slept before. Or they didn't need to take as many ibuprofens with their period, because all of those things have risks. The ibuprofen can just tear a hole in your stomach, and Tylenol, you don't want to take too much because that can mess with your liver. And we don't want to, especially when we're talking about hormone imbalances, the liver is so crucial to metabolizing hormones that we don't want to bog down your liver with toxins that it has to clean up, because when it's cleaning up those toxins, it's not doing its day-to-day jobs of metabolizing estrogen the way that it should. So, so it's been a helpful adjunct. I'm always like so happy when someone tries it and they're like, this was great. This made such a big difference.
Oh, it's going to make you feel good. And on the flip side, they have to be like, wow, I have a provider who's so open-minded and suggested something. They have to feel so relieved, even, especially if they are cannabis consumers and maybe you didn't even know, but they're like, oh my gosh, she suggested this for me. I'm so excited.
Yeah. And, I really do think of it as just another herb, and I recommend herbs and adaptogens all the time. I'm recommending reishi and ashwagandha and tulsi and all of those things. And it's like, it's just another herb, and they all kind of do different things. And this is what this one can help with.
Such a great perspective. And I feel like if more healthcare providers could have that well-rounded perspective, we'd be in such a better place. But I can't thank you enough for sharing your personal story and a little bit about your work and what you're doing. And I want to be respectful of your time, but I also want to ask you the same 4 questions I ask all my guests. Are you ready?
I'm ready.
All right. The first one, what are you most proud of in your life to date?
Yeah, I'm most proud of leaving my original career at the age of 35. And
what was it?
I was a pharmaceutical copywriter in advertising in New York City for 15 years. And I had to leave. It was destroying my mental and physical health. And I had always been interested in nutrition. And so I just started chipping away at going back to school. So I left my life in New York City. I left my career. I left, everything that I know. Really didn't know what was going to happen. And it was worth the risk.
I'm so happy for you. Now, I don't know, a lot of people find this to be the hardest question, but you don't actually use cannabis daily. So I don't know how this will impact you, but what would your life look like if you didn't have cannabis?
Yeah. And, as it relates to the surgery, I would have been, much more afraid of what was going to happen afterwards. I don't think I would have recovered as well because, the cannabis was managing the pain for me, which was allowing me to be able to do the physical therapy exercises afterwards. It was allowing me to get up and feed myself and do all of the things that I needed to do in order to recover. So, I think it made a really huge impact in my recovery.
Oh, I'm so happy that you brought that along with you and were able to benefit from cannabis. If you could go back 10, 20, 30 years ago, give yourself a piece of advice, what would it be?
Oh, that's always the hardest question
right?
to answer, isn't it? I think I would probably say trust your gut because when things aren't right, when you're in a relationship that's not right, when you're in a career that's not right, when you're living the life that's not right for you, and your gut and your symptoms are trying to tell you, get out. They're trying to give you these little signals that hey, this isn't working. You need to try something else. And I think, there was so many years there where I was just so unhappy with, relationship and career and even living in New York City. Can you imagine someone with high cortisol living in New York City, what that does to your mental health? It's not, there's nothing chill about New York City. So, just trusting in my gut that what I was starting to feel was right and that I should listen to it.
And that kind of brought you, to where you are here today. And that kind of brings us to our last question. And it doesn't have to be specifically for the cannabis space, but if you could be remembered for one thing in this space, what would it be?
Yeah, I think it would really be, my work in advocating for women to empower them to be able to advocate for themselves, especially in the conventional medical space. If you're not getting what you need, go elsewhere. This sort of, or, get what you need. And you may have to cobble together some sort of, get this person for this thing and this person for this thing, but, getting your needs met when they're not being met, in one place, whether that's a doctor or a relationship or your career or, everything. Just you can build the life that you want.
That is the perfect way to end this. Thank you so much for sharing your personal story and your work with us. If people want to learn more about you, where can they find you?
Yeah, so I'm most active on Instagram. It's
She has an amazing, I'm sorry to interrupt you. You have a great Instagram account. If anyone's on Instagram, please follow her. Go say it.
Thank you. It's the.hormone.dietitian, and it's dietitian with 2 T's. It's the American spelling. And my website is also thehormonedietitian.com.
Wonderful. I'm going to leave links so everybody can find you if you are a woman with PCOS or any type of female condition, are looking for support with a cannabis supportive provider. Please reach out to Melissa. And again, thank you so much for sharing everything you did here with us today. I really appreciate it.
Thank you.
Congratulations. You've finished another episode of the Well with Cannabis podcast and are one step closer to discovering how you too can live well with cannabis. Thank you for listening in today. We hope this episode has been a helpful and informative one. Please visit EmilyKyleNutrition.com for more information on today's show notes, guest information, recipes, and other resources. If you want more support and encouragement on your cannabis journey, please consider joining the private Well with Cannabis community. In this group, you can connect with like-minded individuals focused on improving their health and wellness through cannabis. Join the group today to continue your journey of wellness together at EmilyKyleNutrition.com.